Do you have engorged veins in your legs? Do you get regular leg pains at night? Do you have ulcers in your feet जो heal नहीं हो रहा है? Are you having varicose veins and venous ulcers? Let's discuss. Hello friends, this is Dr. Arghya Basu, gastro and cancer surgeon, welcoming you all to a very interesting episode of your own YouTube channel Arghya, where we discuss various gastro, cancer and surgery related problems and try to help our patients and viewers with accurate and state-of-the-art medical guidance even at personal level. Hello friends, this is Dr. Arghya Basu, gastro and cancer surgeon, welcoming you all to yet another very interesting episode of our Healthy Chit Chat, where we are going to discuss a few facts about varicose vein and venous ulcers. Many people visit my OPD with big, engorged, bluish, black, bad-looking, ugly-looking veins over both of his or her lower limbs, which are giving him excruciating pain, specifically at night, along with swelling of the feet during the end of the day, and at the same time, blackish discoloration of both lower limbs with occasional non-healing ulcers over one or both the limbs. These are typically called varicose veins with complications like venous ulcers. Now, what is a varicose vein? A varicosity is traditionally described as penalty for verticality against gravity. So now what does it mean? Because these things or these type of diseases most prevalently occur to people who are accustomed to long time standing due to her or his occupational habits. This is more common in tram conductors previously, more common in barbers, more common in people who work in a outside office environment and has to stand on his or her legs for a prolonged period of time for the entire day. So this is pure physics, pure gravity. Whenever you are standing against gravity for a prolonged period of time, most of the blood will try to get accumulated inside your lower limb veins due to effect of the gravity. Now, how our body normally tackles it? There are two types of venous systems in our body, specifically in lower limbs. One is called the superficial system, one is called the deep venous system. And what does it mean? In our lower limbs, there are two types of veins. One system of veins runs superficially. That means not very deep from the skin. If you insert a needle, you will get these veins within 1 or 2 centimeters starting from skin. These are superficial veins. These superficial veins ultimately drain into deep venous system. These deep veins are located really deep inside the anatomy of human musculature of lower limbs. They cannot be seen from outside with naked eye. They cannot be pierced with general needle within 1 or 2 centimeters, and they are actually located really deep inside our leg muscles. So ultimately, these deep venous system drains into internal iliac veins or external iliac veins and then through inferior vena cava into the heart. So ultimately, what is the function of these veins? The veins bring deoxygenated blood from the distant part of our body to the heart. This is the normal flow of venous blood from foot to heart. But what happens in case of varicose veins? See, all venous structures have some kind of doors inside them. These are called valves. A vein has numerous valves within its course. These valves are one-way doors. They only open towards the heart. So whenever a vein is running from the tip of your toe to the heart, all the valves that the vein contains in its entire course actually opens toward the heart, and it allows flow of blood from the distant part of the body towards the heart only. Now, varicosity occurs when, due to prolonged standing, these valves lose their potency or capacity to control one-way flow. Now, if these valves becomes ineffective or incompetent, then blood flow occurs in reverse direction, that is from the heart towards the feet. Now, if a person is standing on his or her feet for a prolonged period of time and the blood is flowing from the heart to his or her feet, what will happen? There will be accumulation of excess deoxygenated blood inside his or her feet. So what will this ultimately result? This will lead to marked swelling of both or one foot of that affected lower limb. Now what will happen to that limb? It will undergo swelling like elephant's feet, which is called edema. This is venous edema. Now, if a patient is having venous edema for a prolonged period of time, what will happen? That blood which is getting accumulated inside the venous system of the patient's lower limb will ultimately come out of the veins into the subcutaneous tissue and will undergo degeneration. The hemoglobin contained within that blood will undergo degeneration and will form a blue colored pigment and make the lower limb of that person totally blue or black in color. This is known as lipodermatosclerosis. In these patients, their legs usually become thinned at the distant parts with engorgement of the calf muscles and will have a inverted champagne bottle appearance. They look like inverted champagne bottles, and they will have a bluish black discoloration, which is known as lipodermatosclerosis. Now here remember one thing, if a patient comes to us with inverted champagne bottle appearing legs and lipodermatosclerosis, by operating on that patient we can halt the progression of the disease, but these symptoms that has already occurred cannot be reversed. The edema can be reversed, but lipodermatosclerosis usually doesn't reverse or takes prolonged time to get reversed. And why it doesn't reverse completely, I will come to that point later on. Please listen to the video till the very end so that you don't miss any vital point, and at last where I will share with you the links how you can get in touch with me and get personalized advice and guidance. Now we will go to the treatment and further discussions part, but before that, if you are enjoying the show and अगर आपको कोई बेनिफिट मिल रहा है तो प्लीज़ ये चैनल को सब्सक्राइब कर लीजिए एंड बेल आइकॉन को प्रेस कर दीजिए so that you will get notification every time we post a video, and this will give me and my team a huge inspiration for our hard work. Thank you. Now without any further delay, let's dive deep into the problem and how we are going to tackle it. Now let's come to the treatment part of varicose veins. Whenever you are seeing that ugly looking engorged veins, don't delay. Please visit to a surgeon or a vascular surgeon who has enough experience in dealing varicose veins. How we can treat varicose vein? There are two methods. One is microsurgery, one is conventional open surgery. What is the microsurgery? In microsurgery, with the help of laser, we can obliterate all the superficial veins so that the veins get destroyed and thrombosed after the laser therapy, which ultimately destroys the entire superficial venous system. So if there is no superficial venous system, there is no backflow of blood from heart to the feet, and ultimately eventually the the edema of the feet or the swelling, the changes that has already taken place because of hemoglobin breakdown and accumulation of blood in feet reverses. The other procedure of treatment is conventional open surgery. The open surgery is also known as Trendelenburg's operation. In Trendelenburg's operation, there is a medical term. What it is actually? It is juxtafemoral flush ligation of great saphenous vein along with ligation of multiple perforators. समझ नहीं आया ना? Natural सी बात है. This is medical jargon. Now let me try to make you understand in a normal man's words. Great saphenous vein is the most important superficial vein that brings blood from the feet to the heart. And how does it go to the heart? The superficial femoral vein ultimately drains into deep venous system, which is a common femoral vein. Now here we are dealing with superficial venous system or great saphenous vein. So juxtafemoral means we are ligating or binding the removing the great saphenous vein from the junction where it is draining into the common femoral vein. So it is juxtafemoral flush ligation. And when we are removing the great saphenous vein, which is the most important vein, there is a procedure called stripping. Stripping of veins. How do we do stripping? We have some specific instruments called Mayer's strippers. With the help of these strippers, we remove the great saphenous vein or any other dilated vein throughout its entirety up to dorsum of foot or to the distant part of the foot. Here we are dealing the main veins, but there are numerous veins in our lower limbs which are incompetent, which are ineffective, which are swollen. So how will we do that? Before doing this operation, pre-operative marking of incompetent perforators is mandatory. We have to take the help of a experienced ultrasonography doctor who is a radiologist who is performing regular Doppler. Doppler ultrasonography of both arterial and venous system is a mandatory before doing any sort of vascular interventions. Here we are not dealing with the artery, but we have to see the arterial system also, because in most of the cases varicose veins are accompanied by atherosclerotic arteries, and whether the ulcers are venous ulcer or arterial ulcer, we have to diagnose beforehand, because the treatment of arterial ulcer and treatment of venous ulcer are totally different. Now if we treat venous ulcer like arterial ulcer, the result will be disastrous. The treatment is totally different. Now beforehand we have to mark the perforators with the help of an experienced radiologist, and at that point of incompetent perforators we have to ligate the perforators. We have to remove small veins which are incompetent, which are ineffective, and ultimately which are leading to the formation of inverted champagne bottle. So this is the operation which ultimately entails removal of all ineffective veins. But now you tell me, there are numerous veins in our lower limb. Is it possible? It is humanly possible to remove all incompetent veins at a single go? No, never possible. We can remove the big veins which we can see, which we can feel, which we can diagnose with the help of ultrasonography or Doppler machines. But there are numerous multiple minute veins which are also incompetent. They cannot be removed. So however good operation we can perform, varicose veins might recur. It is not the fault of the surgeon. A surgeon can remove the incompetent veins that he or she is finding at the time of that operation. But after that operation, numerous veins will be still there in the patient's lower limb, which will become incompetent in future life. So these things can recur. One patient have to bear this in his or her mind. So after the operation is over, after our regular post-operative dressings and wound healings, we often offer the patient stockings, varicose vein stockings. What are stockings? Stockings are very tight socks that we apply starting from the distant end of the foot to the thigh of that patient. This keeps the total superficial venous system of the patient compressed so that no blood can run in reverse direction from the heart of the patient to the distant part of the body. So, so that the changes that has already taken place before performing the operation gradually fades off to some extent. But one other thing has to be borne in mind, that the patient should lose weight. The patient should not be overweight. He or she should control his or her body weight within control. Otherwise, these things will recur again just because of effect of gravity. So just only performing an operation successfully doesn't give you a long-term total cure from varicose veins. But remember that varicose vein is a 100% curable disease. Unless and until you remove the varicose veins and treat it properly, you won't get rid of that night pain or cramps in your lower limbs. So on one hand, this operation removes the ugly looking veins from both of your lower limbs. At the same time, it saves you from the tremendous night cramps that one might have at his or her legs because of accumulation of excess blood in his or her feet. So this is high time that you should be conscious whenever you are observing one or more dilated, tortuous, bad looking veins in your limbs to visit your vascular surgeon or surgeon and seek a consultant's opinion who has enough experience in all sorts of varicosities and vascular diseases. Thank you. You can get connected with me and follow my posts, videos and blogs in my social handles given in the description box just below. If you want a personal consultation with me, please WhatsApp or call in the following numbers. My team members will personally get in touch with you as soon as possible. So friends, hopefully today's discussion was helpful to you और आपको कुछ नया information मिला होगा. Whatever questions you have in your mind, please mention them in comment section. So here is your friend Dr. Arghya Basu, gastro and cancer surgeon, signing off for today. We'll meet very soon in another interesting episode of our Healthy Chit Chat. Till then, take care, bye bye and Jai Hind.